New at 5:30, Secours is opening a new medical office in Richmond's East End right next to the Richmond Community Hospital. That hospital was the center of a New York Times investigation claiming it was severely lacking in services, yet was a profit source for upgrades in wealthier communities.
Elizabeth Holmes toured the office space today and spoke with hospital leaders, and she joins us now in the studio. And Elizabeth, what did they tell you?
Well, I spoke with the market president of Secours Richmond, and he said this new office is proof of the medical group's investment into the East End. They say it will offer a range of services that community members and city leaders are asking for, but others wonder if it will be enough to make up for what that investigation said Richmond's community hospital is lacking. It's a new chapter for Secours, a $16.5 million medical office in Richmond's East End. The space sits right beside Richmond's Community Hospital, a focal point of a New York Times investigation. Richmond Community Hospital, part of a 340B federal program that allows Secours to get medicine for a discounted price, was said to be lacking adequate resources in that report, and money saved through the 340B program was not invested back into the hospital. Secours' Richmond market president saying that's not true.
I want you to hear me when I say it inaccurately reflects who we are, what we've done, and what we will continue to do in this community. Secours invests far more than 100% of 340B savings realized here on this campus, back here into this community.
Secours says one of the ways it's doing that is with this new medical space, staffed with 147 workers, offering several exam rooms, behavioral health programs, and additional support services. Some city leaders applauding the move.
I want to say thank you. Thank you for your commitment to the East End. Thank you for delivering on your agreement to develop a comprehensive strategic health and wellness plan based on input from leadership, from community, from stakeholders, from your staff, from residents. Thank you for that. You said you would, and you've done that today.
But others say it's not enough.
I think anyone who has been in Richmond long enough is aware that that was a project that was supposed to have been started and finished years ago. It's not a project that adds any sort of medical capability to the hospital. It's office space, and the timing of it, I think, is suspect. I think it's more performative than actually making investments in Richmond Community Hospital and making investments in our East End neighborhoods in the way that the 340B program contemplated initially.
Secours plans on starting a 3-year program dedicated to tracking the East End's health progress and expanding medical resources.
Obviously, there's high transparency, there's accountability, and most importantly, it's going to make a tremendous difference to the health status of this community.
Tom Barber with the Richmond City Democratic Committee says if that were true, then there would be significant changes to Richmond Community Hospital.
As the New York Times investigation made clear, it's been deprived of services, it's had its ICU removed. It's a place where people go with serious conditions and end up getting transferred, sometimes with very bad outcomes, to other hospitals because they had to wait in order to get to a place that could provide them the care that they needed.
Now, the Richmond City Democratic Committee is hosting a community conversation in the East End to discuss the investigation and next steps. That will be at Mount Olivet in Church Hill at 6 p.m. on Thursday.